clearing space. Okay. So, I was directed to speak on the subject matter of the jaw. Now, the jaw is a very interesting location for issues because it is really one of the primary muscles and joints that have to be in place and workable and functioning from like minute one, right? So when we're born, besides the first breath that we have to take and all those organs start working, the jaw has to work in order to survive, nourish, suckle, all that, right? So it's tongue and jaw. Now the tongue happens to be, pound for pound, square inch, the strongest muscle we have in our entire body. And it's really obvious because it was developed, right, before any weight-bearing muscles in our body when we were born. So between the suckling and the jaw, which has to move when the infant is feeding, so this whole area is really just the most powerful part of the body. As I have been working on infants for quite a long time and having 3 of my own, I have noticed that infant jaw structure needs to be adjusted pretty often. One, because it gets tired. It's working so hard all the time. And 2, because interestingly enough, I have found that as the baby is carried from place to place, depending upon the genetics of the child from the family, certain infants will have ligamental issues more than others, and so there are lots of different systems to deal with infant jaw issues. Craniosacral is definitely one technique, and I speak of techniques that I know of because I've been trained in them, but also ones that I'm not trained in. So if I come across one that I'm not trained in, I will tell you to get a referral. So craniosacral is a very light touch. It's very, very soft. It's very palpable to the one who's trained in it, although almost unpalpable to the person receiving it. Although very, very, very effective, and obviously very wonderful for infants because you don't have to do heavy pressure. It's also great for someone in the older stages of their life, any stages of their life, that happen to be sensitive to touch and pressure. So the jaw, which encompasses, right, the whole maxillary area, mandible area, the cheekbones down to the chin. The jaw is actually, the tongue is actually attached to the back of the chin. And that combination, the roof of the mouth, the tongue, and the jaw, all have to work in harmony for us to move our food, chew, and all that sort of stuff. So the muscles here will attach along the back of the ear at the temporal area. And a lot of people, will like rub here when they have a temple headache. Well, a lot of times that's from the jaw, okay? There is a syndrome called temporomandibular joint syndrome, TMJ syndrome, which is when the joint is actually misbalanced and the mechanics of it is off. And so there's a clicking every time the jaw opens. So not any different than back deviations, right? So when the jaw bones are deviated or the jaw joint is deviated out of muscle imbalances, it'll cause those dysfunctions. And so some of the ways to alleviate that, besides we mentioned craniosacral, there's also deep tissue. There's also a more integrated structural technique which goes interior to the mouth as well as exterior, which sometimes is absolutely necessary depending upon how much tension and attention is in that jaw. So those are really important, although you can definitely do some work for yourself. one of the biggest jaw muscles is here. You can see it more on men who chew. You can see the muscle kind of bulging in up and out a little bit. That particular muscle is the big guns in the jaw, and it definitely does house all the way through to the temple area. So massaging strongly in these areas, at least to the point of minor discomfort, is fine to alleviate some of the muscle work, and really work all the way around the ear, close to the ear where it attaches to the skin, work under the jaw bone, right under here, all the way along. The muscle stops about halfway. So anything you can do to pinch it, pull it, twist it, all that sort of stuff. The other thing is exercises of opening, right? Those would benefit as well, because that joint typically doesn't get a full range of motion, and like any other joint, full range of motion is necessary to keep it healthy, at least to the point that it's supposed to work, right? So that's the muscular part, structural part. Those muscles that are also managing the jaw can also be down the neck, in this, these I'm trying to see it here, there we go, these big guns here. Those will also facilitate some jaw issues, and those come up a lot in our society because as we sit in the computer, we are jetting our head forward, which is tensing these muscles, and it's shifting the placement of the jaw. So you can definitely go, when you are driving on the freeway, instead of getting agitated with the driver ahead of you or around you, don't be distracted, but you can wrap around that muscle and just give it a little bit of a pinch, and you can see how tender and tight it is. Obviously, you can do this in front of the TV and those sorts of things. This will all, one is it helps flush the toxins that are stuck in those areas and bring them down into the lymphatics, through the lymphatics here and down into the chest, so that they can be eliminated through the body. So that's the structural stuff. Emotional stuff is quite interesting because there are thought processes that can also get stuck in the jaw. The jaw, this area is all about speaking, right? Speaking your truth. What are you holding back? When sometimes there are certain types of people who will clench their jaw because they're not allowed to say something. So what are you not allowed to say? What am I holding back? I want to scream, but I can't. I want to make noise, but I can't. All those things can build up in that tissue, partly because its strength is being held with those thoughts, if that makes sense. So similarly, when you're building a muscle, you're building it to the weight that you may be holding, right? So emotions will also build the muscle, and those emotions will hold in the muscle. So there are I have my little notes. Beep. Sorry. So wanting to speak out loud, sometimes the jaw will clench when there's a feeling of being out of control, needing to express yourself. People don't want to hear what you have to say, things like that. Those are the emotional components to the jaw. If you have been to a dentist, there's a lot of things you want to say and do, but you have to hold that jaw still and open, right? The interesting thing is there are many times where actually the Novocaine will not process out of the mouth. I have had experiences where doing internal mouth structure work, the client actually reignited in his mouth the sense of Novocaine, and hadn't been to the dentist in 20 years, 25 years. So why does that happen? There are just some people do not eliminate those kinds of products as somebody else would. So some people would have a problem and some people won't have a problem. So the point is, if you have jaw pain, these are some of the things that may be contributing to the tension in your mouth, if that makes sense. There are other practices that are orally based, as far as food, smoking, oral sex, all that sort of stuff, where emotions are also involved, and that will also potentially get locked up in the jaw. Interesting, right? So you can, as you're working your muscle, you can also use it in a meditation thought prayer practice. You can ask, show me what is, if anything, show me if anything is locked in my jaw via an emotional or thought process. And just sit and see what comes up, see what evolves out of it. It may or may not be something that seems obvious. The obvious things don't necessarily have to be locked in there. It could be something that you haven't looked at. There are obvious things you've already looked at, so the point of looking at it again is to bring up things that you haven't particularly taken into consideration. So, you could even press on an area that's sore, just to the point of discomfort, right? And you can tap your thymus, which is just between that notch in your neck and the hollow underneath your sternum. Somewhere in the middle, right in the middle of the chest, that's your thymus. So you can hold the area that's painful, wherever that might be. Tap your thymus, breathe it in, and say, I don't have to understand, I don't have to know, please alleviate and heal. Thank you for alleviating and healing this now. And you may get enough just out of that. The other thing that, since we talked about the more oral patterns, chewing is a big deal, obviously with jaw work, right? So pay attention to see if do you hold the phone, on your shoulder one side more than the other. Shouldn't do it anyway. It's great, not really great for the neck, really bad for the jaw. When you wake up in the morning, does it hurt to open your mouth? That means you've been clenching, which means you've been processing at night and clenching your jaw while you're processing. Okay. There was something else that popped in. So chewing. See if you chew on one side more than the other. Right? One may be just out of pattern. One may be because your bite is off because your jaw has already been off for a while. Or you may have a dental thing that you have been avoiding and you've been compensating. There you go. Okay. So those are the types of things we look at when we look at the jaw. The actual structure, the belief and emotions, and the spiritual stuff, which is also the spiritual stuff would be more, say, if I say what I really want to do, then I actually have to hear myself say it. Especially if that comes to something that you've been wanting to do as a life purpose, or something you've been denying yourself. So if you say it out loud, you really have to hear it, right? There's a big difference between saying it in your head and saying it out loud. So if there is a spiritual component to your jaw discomfort, part of it could be tied in with the emotional. And so something to look at, right? If I had a client in front of me with jaw issue, I would look at the corresponding muscles. I would look at the corresponding structures. I would ask and see what emotional patterns and beliefs are in there. Potentially do internal work. Potentially ask them to see what it is that they're keeping themselves from saying, all those sort of things. So everybody has an individuated output, and so I would individuate it and make it special to that person. I don't use template when I work with people, so it really depends on what's going on. Now, it may be a symptom of something else, and so we would want to go there as well. Okay? So, that's the jaw. It's a very powerful, powerful area. And if you're having any jaw issues, I hope that this may give you some other perspective about what might be going on. And it certainly can be cyclical. Your jaw may be fine and fine for a long time, and then a particular kind of emotion comes up, or dealing with a particular person, that pain comes back up. Those are kind of those individuated outcomes that I'm talking about. So, I thank you for listening, and we'll be back for more. Please comment on any observations that you may have. Any questions that you may have, please put in the comment section down below, and we'll see you again. Thank you.